Good morning, everyone. First, let me thank you for taking time out of your very busy schedule to be here with us. And thank you also for inviting us back into your lovely island. We are insurance brokers. As insurance brokers, we do not represent any insurance company. We represent you, the employees. We represent the government of St. Kitts. So do not see us as any representative of the insurance company, because we are not. We are an extension of you. You heard that we represent a company called CGM Gallagher Insurance Brokers Limited and out of Barbados. But I would like to make one small correction. We represent CGM Gallagher Insurance Brokers St. Kitts Nevis Limited, because we do have an operation here. We are one of the largest brokers throughout the Caribbean. We have offices in Jamaica, Barbados, St. Lucia, St. Vincent, Grenada, as I said earlier, St. Kitts Nevis, and we registered in most of the other Caribbean islands. And we partner with one of the largest insurance brokerage firms in the world called AJ Gallagher and Company. So we have an extensive network. We want to share with you the details of the new employee benefits program that went into effect as of August the 1st. It is into basically 4 different sections, where you have a death benefit, which is a new addition to the program. We have the medical benefits, and we also have dental care and vision care, which are also new additions to the existing program. The present program is a basic plan with a supplementary major medical. And basically what that means is that you have certain limits under the base plan, and after you've exhausted the limits under the base plan, the excess of some of those benefits go over into what we call the supplementary major medical for further reimbursement. But those expenses are subject to a deductible and what we call a co-insurance percentage. Generally, as far as the eligibility is concerned, all new employees under the age of 60 are covered automatically. And we are looking, and we've had discussions on extending the benefits under the program, under the medical program, and medical, dental, and vision, that is. We have had discussions on extending the coverage to your dependents now. Previously it was for the employees, and you'll hear a bit more about that. There will be another circular coming out from the ministry in relation to the effective date of the coverage for your dependents. But while we're here, I will say to you that the dependents relate to your husband or wife, or a man and a woman living in a recognized husband and wife relationship, what we call a common law relationship. And according to the laws of the land, you must be cohabiting, I guess, for, I think it is 5 years in order to be considered a common law relationship. But some people do have more than one common law relationship, but the insurance company will only recognize one of those. So remember that, okay? It will also be extended to your children, your stepchildren, and your legally adopted children from the age of 6 months up to 19 years of age, providing, of course, that the child is unmarried and still dependent on you for support. And if that child is going on to a school of higher education as a full-time student, then the coverage will be extended to that child up to the age of 25. But as I said, these are discussions that we've had, and eventually we will be, you'll get some further information on that. I'd like to pause here at this point in time. Okay. Right Honorable Prime Minister, is it your wish to address the gathering at this stage? No? Okay. All right. So the information relative to the dependents then would be sent out to you at a later date. All those persons who are enrolled in the program, there's no, you don't have any kind of waiting periods right now. But for future new employees, after the completion of their probationary period, they will be enrolled in the program at the completion of the probationary period, or you will have a 31-day grace period in which to enroll. And when it comes to your dependent coverage, when that aspect of it is implemented, then you will have 31 days from the day a child is born or the day you get married to cover your dependents without any evidence of insurability. If you enroll way outside of the eligibility period, then the insurer will have a right to ask you to provide evidence of insurability satisfactory to the underwriters before the coverage can be implemented. And let me tell you, the underwriters are some of the most suspicious people in the world, because when it comes to underwriting, if you're even if you're not ill, if your height to weight ratio is not in accordance with proper underwriting standards, then they may ask you for further evidence. Let's look at the benefits. The death benefit is new, and these benefits have come into effect as of August 1st. Under the death benefit, God forbid an employee should die, the beneficiary will receive immediately, well, of course, upon the documentation being submitted, $10,000 will be paid to your beneficiary. And if your death was as a result of an accident, then your beneficiary receives an additional $10,000. We call that double indemnity. So accidental death is an additional $10,000, so your beneficiary will receive $20,000. But suppose you don't die. Let's say that you have an accident and you have loss of limb, and if you lost 2 limbs or your sight as a result of that accident, well, then the accidental death dismemberment amount will be paid to you. If you lost 1 limb or your sight in 1 eye, then 50% of that benefit is paid to you. But for all intents and purposes, when we talk about loss of limb, we talk about severance at or above the ankle or wrist, and loss of sight usually means total and irrecoverable loss of sight. Of course, if you should die, somebody needs to get that money, so you need to determine who will be getting my money on my death. So you have to name a beneficiary. You can name an adult as a beneficiary. You can name a child as a beneficiary. Or you can have estate as a beneficiary. Now, if you name an adult, obviously, you die and the proceeds go to that adult, fine. If you don't have an adult, and you have your estate, but then the proceeds go into your estate, and the executor or whoever of the estate will deal with the distribution of those funds in relation to if you have debts to pay and that kind of thing. But some people decide, well, I can leave it for a child. So you leave it for a 5-year or 6-year or a 7-year-old child or whatever. Reason, some people say, well, you know, when I'm dead, they bring in another woman in here to lick out my money. And that kind of thing, you know. So they leave a child. And a child cannot sign any legal documents. So the money will have to be held in trust for the child until it reaches the age of 18. Okay? All right. Then we have the medical benefits. Under the medical program, it covers you whether you're in St. Kitts Nevis or out of St. Kitts Nevis. It covers you whether you're in hospital or out of hospital. When it comes to expenses outside of St. Kitts Nevis, we're going to go into that in a little more detail, because that is something that's very important, and you need to follow the proper procedures in order that you don't run into any problems if you have to have overseas medical care. Under the daily room and board benefit for local hospital room and board, the previous program reimbursed you at $100 per day. The new program has significantly increased that benefit to $400 per day. So that is a very good increase. And usually the insurance company talks about the hospital's average semi-private room rate. So normally if you go into a private room, it is usual that you may have to pay the difference between the semi-private and the private rate, but it is normally the hospital's average semi-private room rate. And while you're confined in hospital, you have things like lab tests, x-rays, drugs, dresses and supplies, and use of operating room, and all the miscellaneous charges you have as an inpatient. Those things have now been increased from $500 under the previous program as an inpatient to $750 as an inpatient under the new program. And outpatient benefits, they will pay up to $200 under the previous program. We will now pay up to $500 under the new program. Again, significant increases. Surgery. If you have to have a surgical procedure, the program used to pay $3,000 per disability, or I guess it's per annum or per disability, and that has now gone from $3,000 to $5,000 under the new program. Insurance companies always talk about reasonable and customary charges, so I think it's a good point here to give you an idea as to how do we arrive at reasonable and customary charges. Let's say that there are 5 surgeons performing a particular surgical procedure. Suppose we're talking about appendectomies, for example. And 4 of those surgeons charging $5,000 to do that procedure. And 1 surgeon decide, well, instead of $5,000, I'm going to charge $8,000 for that particular procedure. Then that 1 surgeon is not reasonable or customary. So the insurance company will look at the 4 surgeons that are charging within the similar ballpark figure for that procedure as the benchmark. So that would be considered the reasonable and customary charge. Anesthesia. If you had to have anesthesia, well, of course you should have anesthesia as a result of surgery. That is payable at 25% of the surgical maximum. Previously, the limit was $750 under that disability. That has now moved to $1,250. Again, a good increase in that particular benefit. We also have doctor's visits. And the doctor's visits, you have office, hospital, and home. And you also have specialist consultations. Now, the general rule is that if you go to a general practitioner and you cannot be treated effectively, then the general practitioner should refer you to the specialist for further evaluation and treatment. There are some exceptions to the rule. We understand that if you go direct to a specialist in the particular field of medicine for the complaint that you have, then, like for example, let's say a lady went to a gynecologist for a gynecological complaint, then that will be paid as normal without the referral. But generally speaking, you should have a referral to the specialist from a general practitioner. If you go direct to, well, it's on a case-by-case basis, but if you go direct to a general practitioner, generally, if you go direct to a specialist, generally the insurance company have a right to pay you the general practitioner's fee, unless, of course, there was that referral. And if you refer to the specialist, well, then it means that you're allowed 10 specialist visits, and then the specialist send you back to your general practitioner for follow-up care. Under the doctor's visits, the office and hospital visit, it was previously $60. We've moved that to $80. The home visit at $80 has remained the same, and specialist consultations, $100 remain. But the annual maximum previously was $1,500, and we've now moved that to $2,000. The annual deductible of $40 has remained the same. We also have prescribed drugs. Under the prescribed drug benefit, you should have a written bill from the pharmacy with the name, the cost, and the prescription number. And generally, you will find that most health insurance policies will say drugs which are obtainable without a prescription, even though they were prescribed by a doctor, are not covered under a medical program. And let me sort of explain that briefly. Let's say that a person was suffering from a bronchial infection, and the doctor treated them with antibiotics. Because you can only obtain those antibiotics but from the pharmacist and being dispensed by the licensed pharmacist, that is covered. But if the doctor said to you, look, you have a cough and Therefore, I think you should take some cough syrup, because you can walk into the drugstore or even a supermarket and take that drug off, the cough syrup off of a shelf. That is not normally covered under a program. We call that over-the-counter drugs. So make sure that you have your drug bill with the name, the cost, and the prescription number, because if you have to have a repeat of the prescription, the number would follow on. There are one or two exceptions to the drug rule, though, because, again, medical programs will not pay for drugs which are considered birth control. So if you're going to get pills because you just want birth control, no. And they will not pay for any sex enhancement drugs either. And these are things contained in the policy. So things like the Viagra and Cialis and those things are not generally covered under the program. If the Viagra and so on is used in cases like where you had that, because it was generally developed for people who had certain heart conditions. If it's prescribed by a specialist for that, but then it would be considered, but generally not for any kind of sex enhancement drugs. Say again? The previous maximum benefit there was $500 per ailment or per annum, and that has now gone to $750. And there's a $20 deductible per ailment, which was a carryover from the previous program. Also, when you go to the doctor decides that he or she must send you to have further evaluation or so on. Then, if you are sent to a lab, suppose you go to have diagnostic tests done, like a lab test or X-rays or whatever. These must be ordered by the physician. You can't just get up in the morning and decide, well, you know, my hand hurts me, so let me go and have an X-ray. Or, you know, I got a chest pain or something like that, so let me go and get an ECG. It must be ordered by a physician. And so long as that is done, the program previously paid $750 per disability or per annum. That has now been increased to $1,000. So again, another increase into the benefits, more realistic limits. Physiotherapy is there as well. There's no change to that, and it's the same as the office visit of $80. It also covers maternity benefit. Now, under the maternity benefit is paid a little different to all other areas of the medical plan. And that is that so long as it relates to maternity, from the date of inception to the date of termination of the pregnancy, they add all the charges and they pay a flat amount. So for a normal delivery, previously it was $1,500. That has now moved to $2,500. For cesarean section, it used to be $2,250. We have now increased that to $3,750. Now, some of you may have on your leaflets, there was a little change there where the limits were listed incorrectly between the cesarean and the miscarriage. So just let me go over that again for you. Normal delivery, previously the amount was $1,500. We've now increased that to $2,500. Cesarean section was $2,250. We have now increased that to $3,750. And the miscarriage or legal abortion has gone from $750, and we've now increased that to $1,500. Sometimes there may be certain complications of pregnancy. And in such cases, not in all cases, but in some cases, you will find that the insurance company would have to deal with certain complications of pregnancy a little differently. So rather than just pay them under the stated amounts there, certain complications of pregnancy will be treated like any other illness under the regular headings of hospital room and board services, surgery, and doctor's visits, and so on. But not in all cases, but something like, say, pernicious vomiting with toxemia and stuff like that, which would be considered a severe complication of pregnancy, will be treated a little differently. It also covers private duty nursing. So if a person was injured or ill and there was no one, I mean, family got to go out and work, you know, to help meet the bills and so on, and you had to have private duty nursing come into your home, the insurance company will pay maximum 8-hour shift, 80% of the reasonable customary charge for a private duty nurse. It also covers local ground ambulance, which is 80% of the reasonable and customary charges again, and that's paid under the hospital services benefit. We also have a psychiatric benefit. But, you know, this is a benefit that's on the medical programs, and a lot of people tend not to use it for a number of reasons, because it's not our culture. You know, you find more North American and Europe people run into the psychiatrists and psychologists all the time, but we tend not to use it in the Caribbean because a lot of people don't want us to know we're mad anyway, if we are. So some people refrain. Some people prefer not to use it. But it's there in case we need to use it. And we've not made any change basically to the amount of 80% to $60. But what we have done, we moved the lifetime maximum from $4,000 to $10,000. Another benefit that is in the program now, and it has been included in many health insurance programs around the region, and that relates to AIDS or any AIDS-related illness. It was not a part of your program previously. God forbid anybody have to use it under this program, but we have now included a benefit there up to a lifetime maximum of $50,000 for AIDS or any AIDS-related illnesses. Room and board, overseas room and board. And we need to look at the overseas room and board. Previously, if there was overseas, if you've been recommended to go overseas for medical treatment, which is not available locally, the previous program paid up to $300 a day for overseas room and board. That has now been increased to a much more realistic figure of $2,000. Because, you know, if you have to go overseas, especially in North America, for medical attention, $300 can probably only get you into the accident and emergency department. So a room and board limit of $2,000 is much more realistic. I forgot to mention that under the private duty nursing at home, it must be by a qualified nurse other than a close relative. Okay? Other than a close relative. Under the maximum benefit, for persons under the age of 65, the previous program was $100,000 local per annum. And for overseas care, it was $200,000 local or per annum. Sorry, $2,000 overseas or per annum. We have moved that to $750,000. That's a significant increase, and that benefit is known as a renewable 3-year benefit. So it means that you look back at what's been used over the years and you can top back at the amount. So you could find that the $750,000 can be reinstated. Okay, so that is a very good benefit as well. For persons, retired persons also between the age of 65 and 75, the benefit has not changed. It's $100,000 local per annum and $200,000 overseas. But I should mention here that with the retired persons, it is there's a contribution required from you to remain in the program. And I understand that the contribution for the retired persons is $75 per month. Right, Calvin? $75 per month. Currently, $75 per month. The annual deductible has remained at $200 local and $400 overseas. And basically what that means is that of the expenses that were incurred and carried over into the supplementary major medical, the first $200 of local expenses is a deduction, and then the insurance company pays you 80% of the other expenses. But under the coinsurance payment, again, there's a significant difference in the coinsurance percentage Because under the present program, the insurance company, when you incur those expenses under major medical, will reimburse your expenses at 80%. So this means that your 20%, you know, for a small claim, the 20% will not be anything that will have a significant impact on your finances. But let's say that instead of a $1,000 claim, where your 20% is $200, the insurance company will pay $800 and you'll be reimbursed $200. Suppose that claim now was $100,000. Under those circumstances, on the $100,000 claim, 80% would be $80,000, and 20% obviously is $20,000 out of your pocket. So what we have done, we have changed that system, and we have now gone that the insurance company will reimburse 80% of the first $50,000. So that means that your 20% will now be maximum $10,000, will not exceed $10,000. Under the previous system, you would have been paying $20,000. And if the claim is in excess, as we know of some people who had claims in excess of $500 and so on, that 20% could be a significant amount. Someone? Sorry, 700,000. So you realize that that 20% would have been a significant amount coming out of your pocket, or your family's pocket, I should say. So we've capped that 80% on the first 50,000, so your 20% will not go past $10,000. That, again, is a very significant difference, especially for persons with high expenditure. Yes. Right. The 80% on the first 50,000 and all expenses in excess of the 50,000 in that year then will be reimbursed at 100%. Now remember, we talked about the expenses that are carried over into the major medical, right? And those expenses are what we call the reasonable and customary charges. Again, reasonable and customary, as I explained to you, is that they will look at what the majority of practitioners or medical care providers charging for a particular procedure. Suppose you are ill or injured to a point where you cannot receive the medical treatment in St. Kitts Nevis, and you have to go overseas for medical treatment. The procedure, and this is important because the insurance companies are very strict. All insurance companies are very strict when it comes to the overseas care situation. For example, as I said, you're ill or injured and you cannot receive the medical treatment necessary in St. Kitts Nevis because maybe a lack of trained personnel or a lack of equipment. And on the advice of the physician, usually it should be a specialist in the particular field of medicine, but on the advice of the physicians, you cannot have that done here. You have to go overseas for medical treatment. Then they will give you a referral, which must be sent to the insurance company. And the insurance company will liaise with their chief medical officer. And so long as it is agreed that it cannot be performed here, then the approval will be given for you to go overseas to have the further evaluation and treatment. So you must get the insurance company involved. Not only because it can't be done here, but the insurance company have what they call case managers. And those case managers are there to go and negotiate the fees on your behalf. Overseas providers, you know, they have what they call bundle rates, and, you know, they give you these rates for, especially if you got insurance, you know, sometimes the rates go up. So they have these bundle rates, and when the case managers get involved, the case managers negotiate more favorable rates for you. And we have proof of people who go up, and you may find a case where the cost was like 180,000 US, and by the time the case managers were finished, the cost was down to like 78 or 80,000, something like that. So it's also important to let the case managers get involved, who will monitor your progress and negotiate the fees on your behalf. But suppose you are overseas on business or on holiday, and it was an emergency situation. And when we talk about emergency, we talk about a non-planned situation. In a situation like that, you can't expect the person to get on a plane and come back here, and it may be a situation where you have to go right back. So the insurance company would take into consideration the expenses, the reasonable customary expenses in the location in which the expenses were incurred. But you should also get in contact with us, get in contact with the insurance company, and let them know you have to have the medical treatment, or at least within 24 hours of having that treatment, so that they can put their case managers in place as well. And if you must go overseas for the medical treatment which is approved, the previous program paid 80% of your airfare up to $3,000 maximum per year, with a maximum of 2 trips per calendar year. We have now moved that where the insurance company, on approval, will pay 100% of your airfare. But please, don't go and book a first class airfare now. It is 100% of the economy airfare, so remember that. Okay? They'll pay 100% of the economy airfare. Again, that is another significant increase. And if your illness or injury is considered life-threatening, and again on the advice of the specialist, you must be airlifted out of St. Kitts Nevis immediately to the nearest location where you can receive that, that critical care. Then the insurance company, and this is a new benefit, the insurance company will pay for an air ambulance to come to St. Kitts Nevis and take you to the nearest location. And the air ambulance, you have, trained doctors and nurses and medical equipment on board. So they'll come here and they will take you to the nearest location where you can have the critical care. That is a new benefit. And all these benefits, as I said before, are effective August 1st. We also have some preventative care benefits. Now, these benefits are not subject to any deductibles or co-payments, and they are done purely as a checkup. Now, previously, medical plans were designed for injury or illness, but prevention is better than cure, so most plans are now have these preventative care schedules. So previously, we did not have the annual physical examination, so now, for the employee only, the annual physical examination, which would include a clinical examination, blood pressure check, respiratory check, complete urinalysis, and lipid profiles. The insurance company will pay up to $200 towards that, that checkup. That's a good benefit. The other benefits under the preventative care, and remember again, these are done as a checkup and not part of a medical problem. Annual gynecological and pap smear test previously was $25. We've increased that to $75, and that's once per year. The mammogram figure has gone from, the mammogram and the prostate exams have remained at $150 once per year. And a new benefit, remember that the mammograms and the proctology prostate exam between the ages of 18 and 39 is 1 per 3-year period, 40 to 54 1 per 2-year period, and 55 and over 1 per year. A new benefit that's been added is an annual electrocardiogram. So if you had to have an ECG done as a routine test, the insurance company will now reimburse that up to $65. Again, another very helpful benefit under the program. Those are the medical benefits. But before we move on to the dental and vision care, which again are new benefits, I just want to make you aware of 1 or 2 conditions of the policy. Some people ask, well, suppose I covered already. It makes sense covering here again or whatever. Excuse me. Okay. Can you hear now? If you could just hold for me 1 minute, please. Thank you. Okay, there are one or two things that we should make you aware of. As far as being covered on more than one medical program, yes, you could be covered under more than one medical program, and there's a thing called the coordination of benefits. But let's look at it from, and we talk about dependence now because that's something that we're moving towards sometime in the near future, we hope. Let's say that the claim is on you, your benefit plan will pay first. If you're covered as a dependent under your husband or your wife's plan with another organization, then that plan will pick up and pay the difference not exceeding 100%. If the claim is on your spouse, then their plan will pay first. And if they're covered as a dependent under your plan will pick up and pay the difference not exceeding 100%. If it is an individual policy, we will have to look at what the individual policy conditions are in relation to coordination of benefits. But if it is an individual policy, you can still claim both places. You claim under one, and then you pick up and pay the difference under the other one, so that you don't exceed 100% of the expenses that were incurred. As far as when the dependent coverage comes into being, there will be a contribution from you to cover your dependents. And the contribution would be divided into two sections. If there's one dependent, it may be just a husband and a wife with no children, or it may be a woman with a child, or a man whose wife may have gone and he's got the responsibility of raising the child. The premium would be for the employee and one dependent, or there would be a premium for the employee and more than one dependent. That would be husband or wife and dependent children, up to 4 children. And if there are more than 4 children in that family unit, then the insurance company can ask for an additional premium. But those premiums we're trying to confirm those right now. So I will refrain from giving you the exact amounts at this point in time. Okay? There's also another thing that is important, and that is an injury happening on the job and a job-related injury. The difference being that if you are doing a particular job, and as a result of that job, you got injured, and it is proven that your injury or illness was as a result of your job functions, then that can be considered job-related. And if it is job-related, insurance companies really will not pay for the negligence of a third party. Of course, you must still prove negligence on the part of the employer before it can really be considered employment-related. And if it is considered job-related, you have other programs like Social Security, or what we call employer's liability or workman's compensation, and those types of things. So there's a right of recovery under another program, then the medical plan will not pay. But if it's just a case you running through the office to catch somebody to give them a message, and you trip up over your own 2 shoes and fall down and injure yourself, well, then that can't be considered job-related, even though it happened at work. Okay? So where it is not job-related, then the insurance company will have to honor the claim. Okay? Just like, I mean, if you're going home and even somebody driving recklessly and they went off-site and hit you with their car and damaged you, their insurance company is responsible under the third-party section of the policy to compensate you for your pain and suffering and your loss of earnings and all those things, not the insurance company paying for the negligence of a third party. Okay? So I just wanted to clarify that. There's a pre-existing condition limitation. For those persons who are already enrolled, this will not apply. But for persons now coming into the program, any disability which originated prior to the effective date of coverage will be excluded, but that exclusion will cease after continuous coverage, at least after 180 days of continuous coverage without any expenses being incurred. There is another area there where for things like diabetes or cardiac care, those ailments will continue to be excluded for 2 years without medical expenses being incurred for that disability. That's something that I probably would like to discuss a little more, but that's it for the time being. Remember, with the overseas care, that failure to obtain permission prior to going for your overseas care could result in the insurance company paying the claim at reasonable and customary charges locally. Let's go on now to the dental and vision care. Effective August 1st, these benefits are now part of your medical program. Under the dental program, the maximum per person per calendar year is $2,500. And there's a separate deductible under the dental. So long as you satisfy the first $50 of expenses for dental care, the insurance company will pay you according to these percentages. If it is preventative care, which would include cleaning and exams and x-rays and polishing the teeth and so on, the insurance company will reimburse 100% after your deductible. For minor restorative services like fillings, extractions, medication, surgery, periodontal gum disease, and so on, they'll pay 80% of the expenses. And for the other restorative services like crowns, bridges, dentures, and root canal benefits, they also pay 80% for that. They will allow you to have no more than 2 preventative care sessions in a year. Normally, most insurance companies will limit it to no more than 1 preventative session in a 6-month period, but it doesn't limit you to that right now. It just says not more than 2 in a year. And things like mislaid, loss, or stolen dentures are not covered under the dental program. So, we also have the vision care program. Again, new benefit. The maximum per person per year is $600. It's not saying it can give you the most expensive glasses, but it will assist you in obtaining a pair of glasses. And the maximum per person per calendar year is $600. The annual deductible is $50. So having satisfied the first $50 of expenses, the insurance company will pay 80% of the remaining expenses not exceeding $600. The limitations there are that you're allowed 1 examination of your eyes in a 12-month period. You're allowed 1 set of lenses, which will be reimbursed in a 12-month period. And you're allowed 1 set of frames in a 24-month period. But you will not be allowed regular glasses and contact lenses in the same year. The plan does cover contact lenses, so you will not be allowed both in the same year. And with the vision care, remember the vision care program is purely having your eyes checked to determine that you need glasses or not, and if so, to assist you with glasses. Things like conjunctivitis and pterygiums, cataract surgery, detached retina, glaucoma. Those things are medical conditions, and therefore those are covered under the medical program. Just a few exclusions: that expenses for cosmetic surgery not normally covered unless it's as a result of an accident or after surgery. Tubal ligations, vasectomies, and other means of birth control, or any operation to induce pregnancy or to determine the cause of infertility. Periodic health examinations unless, as mentioned under the preventative care program, and things like rest cures and custodial care in periods of quarantine or isolation. The insurance company, they have the case managers for the USA, Canada, and Europe. That's a company called Consolidated Management Network, worldwide managed care partners. And out of Trinidad, there's a company called, let's go over that. For the USA, Canada, and Europe is the Worldwide Management Care Network. And for Trinidad, who would, I guess, look after the Caribbean somewhat, would be a company called Consolidated Medical Management. Okay. you are provided with, you will be provided with a medical card, and that medical card and a booklet. So you'll be getting new booklets, and you'll be getting a medical the international medical card. That medical card is to be treated, you know, with care, because when you go overseas for medical treatment, what you should really do is present that card to the person in charge of admissions, and they should call the number to verify first that you're covered and to guarantee payment. But remember, all medical institutions, they just do not have to accept the card. But if they follow procedure, they should realize that there's nothing to worry about. Okay? So if you're having any problems, get on the phone, get in contact with the insurance company, get in contact with your HR division, or get in contact with us. And when it comes to large and complex claims, overseas claims especially, please let us get involved and let us try and guide you along the way, because we will liaise with the insurance company to make sure that everything goes smoothly. Because the worst thing you want is to be overseas in a foreign country faced with a mounting medical expenses and you don't know where to turn. It can be very frustrating. Claims, we anticipate, unless there are problems, if the claim is properly completed and the supporting documentation is there, we do not see any reason why the claim should take longer than 15 days to be settled and sent back to you, providing that the claim is straightforward. And remember that when you're submitting your claims, make sure that you do so within 90 days of the date the expenses were incurred, so that the insurance company will not time bar the claim. I think I've spoken enough. I will shut up now. And if you have any questions, excuse me. At this point in time, I will give way to the Right Honorable Prime Minister.